So we're going to be going live to our page, and I'm going to share it to our Facebook group because I don't know what the issue was there. I'll have to research that. There we are. We should be streaming live, and I just want to say thank you so much to Dr. Lucia Cheng for joining us today and talking to us all about perinatal mental health and treatment options. I want to welcome you to this chat, and you can certainly provide any questions you may have for her in the comments. I'll be moderating that. But for now, I'm just going to let Dr. Cheng take it away after I introduce her bio first. She is a board-certified psychiatrist and lifestyle medicine physician specializing in perinatal psychiatry. She currently cares for patients across 9 states, which is incredible, through her tele-psychiatry private practice, Phoenix Progressive Psychiatric Services. Dr. Cheng is also an active member of Postpartum Support International and is a volunteer consultant for the PSI Prescriber Consult Line, which is all amazing things. We are so glad to have her today, and I will let Dr. Cheng take it away.
Sure. Well, thank you for inviting me. Happy to be here. I'm basically just here to answer any questions regarding, PMAD or, medication management or, any type of treatment for postpartum depression, anxiety, OCD, psychosis, any of that. Happy to share any knowledge. Just my one disclaimer is I am not legally allowed to give any type of medical advice, so I cannot comment on specific cases. I really can only just educate and give information. So are there any starting questions? Anyone in? Did you have any questions or topics you wanted me to kick off first?
You can start with anything you'd like, and if there's any questions or comments in our live, I can definitely let you know in the chat.
Okay. So one of the things that I work a lot with PSI. I also regularly monitor the public-facing Postpartum Support International Facebook group. I'm on Facebook a lot. That's my main social media medium. And a lot of topics get discussed in that group that gets brought up a lot. And one of the things that I see very commonly is with the struggles with, the postpartum depression, postpartum anxiety, I see so many moms who during pregnancy and postpartum, they're suffering with depression and anxiety symptoms, and they are really averse to trying medication treatment. Even if they have had good response to medication in the past, there's this belief that, medications are bad, it is unsafe, and they decide that they really want to just grit their teeth and try to get through it the best they can to try to keep things as safe as possible for, for their babies, which is, very understandable from where that comes from. However, I think one of the things, and this is a major concept that perinatal psychiatrists like me, that we educate a lot of our patients when we see them, is you have to understand the real comparison on safety when you're making that kind of decisions. Medication-free doesn't mean risk-free. And what a lot of people don't understand is that when you have uncontrolled depression and anxiety symptoms during pregnancy and in breastfeeding, your body responds to that stress by increasing the amount of stress hormones that your body produces. So it's the fight or flight hormones, cortisol, norepinephrine, epinephrine, a couple others. And those stress hormones, the higher levels of those do go through to the placenta as well. They also go into the breast milk. So your baby is literally drinking in via, the blood flow in the placenta or through breast milk, mom's stress. And we actually do have a lot of information and good research, including brain MRI studies, showing that both in utero and breast milk exposure to mom's elevated stress hormones can actually cause an increased risk in those babies developing mental health and behavioral problems of their own later in life, which we do not see with antidepressant and anti-anxiety medication exposures. And so just because you think that not taking medications is going to protect the child, that's not actually the real comparison. Med-free is not risk-free. Sometimes, taking the medication and getting your symptoms under good control is actually safer for the baby than trying to grit through and deal with the symptoms. Your baby is still noticing it, and it is affecting baby's brain development.
That I love the saying you said, it's not risk-free. There's such a conversation to be had around, risk and benefit, and what's going to be most beneficial for the mama. And so I would like to ask, what type of questions are the most appropriate? How can a mom come and have that conversation while she's pregnant, if she's struggling?
Well, most people have a primary care doctor, or if they don't, they really should, because that is the primary medical contact that you have that kind of takes over and helps you to stay healthy and deals with any initial medical issues, or at least an OBGYN, especially if you're pregnant. Most women who are pregnant do have their OBs. If you have a good relationship with them and you trust them, then that is a good place to start, just letting them know how you feel. The Edinburgh Postpartum Depression Scale is a validated questionnaire that is 10 questions, very easy to answer. Most medical personnel they're trained and they know how to give that questionnaire. And that is a really excellent screening way to figure out whether or not somebody, even during pregnancy, just because it says postpartum doesn't mean that it can only be used postpartum. It actually is validated for during pregnancy as well, because a lot of depression actually starts during pregnancy, not just postpartum. So starting with your primary care doctor or OB is a good place to start. For people who have had issues in the past with depression or anxiety, if you have a therapist is also a great place to reach out initially, and then the therapist may recommend that you speak to a psychiatrist. And please take that in the most neutral fashion possible, because something that another misconception is, if you go see a psychiatrist, you have to start medication, and that's actually not true. Part of what we do is doing an evaluation and then deciding whether or not medication would be helpful. So we don't actually medicate all of our patients. We work with the patient, we get the history, we get the information, we do a comprehensive evaluation, and we are aware that there are a lot of treatment options other than just medication. If medication is helpful, it is our job to let you know about them and how they would work. But if we feel that maybe medications are not the best treatment for you or your situation at this time, and therapy or other types of alternative treatments may actually be more beneficial, then it doesn't hurt to have that information. And so if you do have a primary care doctor or an OB or a therapist who recommend that you at least see a psychiatrist, doesn't mean that you have to be on medication. It just means that you're getting a specialist's overview and recommendations as to what may help you the most.
That's a great way to answer that. And I really love your insight, or specifically around perinatal mental health and how these moms can seek treatment, and that, not all psychiatrists, you're not all just slapping on medications, is really important too. I think an important question that I would imagine people may have is, what if someone is getting prescribed a new medication, what are some things that they can expect, or some risk factors or some warning signs that they can expect on a new medication?
So it really does depend on what kind of medication you are being started on. There's multiple different classes of antidepressant medications. A lot of antidepressant medications actually also work very well for anxiety, some don't. If there's more concerning mood issues, like there's a history of possibly bipolar, or there are some symptoms with mood swings or anything like that. Sometimes what we call a second generation antipsychotic medication, an SGA or atypical medication may be used, which are also also FDA approved for being used to treat depression or some anxiety and some bipolar disorder issues. And depending on what class of medication you get started on, it does change the landscape of what potential side effects that you have. However, do understand that anything that affects mood typically takes several weeks for it to start working, because you do need to build up the med concentration in your body until it gets to a high enough level in your bloodstream for it to actually get into your brain and make the changes that it needs to in your brain. And so being patient with these medications is very important. For almost everybody, there is a bit of a transition period because you are putting mind-altering chemicals into your body, and the brain really doesn't like sudden changes. And so whenever you're introducing a new chemical, it takes the brain a little bit of time to get used to it. And so in the meantime, you do have some potential side effects. Usually for most people, it's more stomach-related issues, especially with most of the antidepressants, gas, bloating, diarrhea, constipation. Some people get some, blurry vision, some dizziness, some headaches. Some people may, feel a little bit more tired than usual, or they actually may have a little bit more difficulty falling asleep than usual. Some people, their mood swings may get a little bit worse initially, or some people's anxieties may get a little bit worse initially. But usually for most people, after about 3 or 4 weeks, the body gets used to the medication, and then most of those side effects tend to go away.
Awesome. I think it's so important for people to know that these medications, they don't, take effect right away, and it does take time. And I think another question people may have is, moms are getting resources and information from anywhere and everywhere. Dr. Google, mom groups, all sorts of places. What would you say is some of the best evidence-based resources for a mom looking into medications herself?
So, granted, I'm a physician. I'm a little biased here, but I would say the best resource is your physician. There is a reason why these medications require years of schooling and licensing exams, and we have to pay for registration. We're on the list of the government's list as people to target if there is a problem with medication. These meds are prescription for a reason, and believe me, doctors, we make no money off of you guys being on the, I do hear a lot of people saying, well, these doctors are, making money off big pharma. Please don't believe that. I haven't gotten a single penny from drug reps for prescribing these medications. But we are trained, and especially psychiatrists, we spend years just learning about the different nuances of the different antidepressant meds, the different anti-anxiety medications, how they interact with each other, how they interact with medical issues, ways to optimize these medications so that you have the most possible benefit from it, minimizing the most amount of side effects. And so really, if you're thinking about taking a psychiatric medication and you have a psychiatrist, they really are the best people to talk to because they can answer your questions really personalized to your specific situation. You can read a lot of stuff on the internet, and they're just very general. It doesn't really give you the nuances of this medication versus that medication, other than some people saying, this medication is terrible, I had all these terrible side effects off of it. But you can find that for every single medication that is prescribed. And I always warn people, you have to be really careful what you read on the internet, because the people who do well on medications, they're happy, they're energetic, they're functional, they're off living their lives. They're not in front of their computer typing up how angry and upset they are about the care they receive and the medication that they're on. It's the people who are struggling who are there complaining about the medication and about their treatment. And so you get a very skewed view of that on the internet. So be careful with that. There are some good curated, reliable sources of info, like MD Consult is a good place to go. Mass General Hospital, they have a Center for Women's Mental Health website, excellent website. They have a lot of really great curated information. Every time that there's something about mental health treatment, women's mental health treatment in the news, their expert, the person who manages all their blog, will be typing up something regarding that. I remember a few years ago there was a big stink in the media about how, exposure to psychiatric medication will increase the risk for autism. That caused a lot of concern. And, within a week, the MGH website responded with, this is the evidence base and this is the research studies that we have shown, and this is not true. There is no link between exposure to antidepressant medication with autism and pregnancy. And so they are a really excellent resource. If you're concerned about safety of particular medications, first of all, talking to your doctor, either your OB or your psychiatrist, still is the most reliable information. But LACMed on their website has some really good information, and mother2baby.org also has, they actually have these nice printouts that you can download and print out that are specifically written for lay people. And it's, there's one for most medications. Not, I wouldn't say all, they're not that comprehensive, but they have a pretty good list of prescription medications, and not just psychiatric medications, other blood pressure medications, diabetes medications, that stuff, as well as some vitamins and then over-the-counter medications that you can get to. So they have some a pretty good database of information.
Awesome. Thank you so much. It's very rare I get to speak to a psychiatrist who specializes in perinatal mental health. So I'm very, very grateful for all of your information and the resources you're providing. And while we're talking about resources, and maybe thinking of professionals that may be joining us, and this is good for families to know too, is a consult line that you're a part of and that you help with, that is available free of charge for any provider, specifically for providers, but families can easily print out that information and say, I would like for you to call this person just to be sure. And so tell us about that specific resource with Postpartum Support International.
Sure. So this is the prescriber consult line, and with Postpartum Support International, it is specifically for medical prescribers. So you have to have prescribing capability. So it's unfortunately not for like doulas or therapists or anyone like that. You have to be medically licensed to prescribe, because we specifically give guidance about medication treatment. But it is free. It's a completely free service. There's a website. There's also a phone number that you can call. Leon Swanson is the head of that program. She's very good about, getting back to whichever caller, getting you scheduled as soon as possible. There's a large group, large being relative, because there aren't a whole lot of perinatal psychiatrists in this country. But, most of the perinatal psychiatrists that I know in my circle, we volunteer at least a little bit for this consult line. And so, we actually know each other quite well. Everybody I know who is on that line is excellent, very knowledgeable, all passionate. We're all volunteers. We're not getting paid to do this. And so we're doing this out of our passion because we really love doing this. But it's an excellent resource. We're very happy to help. We're happy to give, medication guidance about really anything related to perinatal mental health treatment. It's national, and so you can call no matter what state you're in, doesn't matter about state licensing. A couple of states actually have their own specific programs very similar to this for their states or their coalition of states kind of in the regional area. So McPat for Moms is out in the Midwest somewhere, and Periscope Project I think was started by Wisconsin, Medical College of Wisconsin, and they have very similar services as well. Down in Texas, specifically Austin, the Reproductive Psychiatry Clinic of Austin, they also provide a free service down there for prescribers in Texas. So we're out there, so please, it's a free resource. If you feel that your OB is struggling, or your primary care doctor is struggling, or your general psychiatrist is really struggling with managing medication treatment, and you want them to at least get that extra guidance free of charge to them, they just have to find the time to do it. We're very happy to help them.
Awesome. Awesome. And I love that resource is available. And if there's anybody listening that knows people that may be struggling, if you are struggling yourself, you can also go to psidirectory.com and find a specialized therapist, specialized doctor, even support groups in your region. If you're not able to join PSI's support groups or our support group. So I definitely recommend that PSI directory. It's amazing. And it's just an incredible resource for perinatal families. I think I don't see any other questions in the chat or on the group. But I also wanted to give a plug for this group because this is our first presentation for the Digging Deeper into Motherhood group, our Facebook group. We will be having live, weekly, and pre-recorded calls within that group about all sorts of things to deal with motherhood. And I'm so glad we got to kick it off with maternal mental health, because that's certainly what we are here for, and our passion. Do you have any final thoughts or anything else to comment on, Dr. Cheng?
So I do want to just give a plug for my subspecialty. A lot of people don't know that perinatal psychiatry exists. We're perinatal psychiatrists. We're also reproductive psychiatrists. We're a very small niche subspecialty within the psychiatry group, but we're all very passionate. We specialize and we put a lot of effort into staying up to date on the research, whatever research is coming out regarding, treatment, medication treatment and management during the perinatal period for mental health. We do have much more specialized knowledge in this area, in which we're much more comfortable managing, medications in pregnancy and postpartum. A lot of psychiatrists, while they're excellent psychiatrists, they are a little weaker in this particular area, not to minimize the knowledge of my colleagues, but if you do feel that your psychiatrist or your primary care doctor or whoever your prescriber is maybe is struggling to handle your treatment issues, or you just feel like you really want to have the more subspecialty pair of eyes taking a look at your case, I do want to recommend that just consider getting a one-time consultation with a perinatal psychiatrist. One of the good things about COVID, very few, but one of the good things is that it really drove a lot of providers to telehealth. And so the vast majority of perinatal psychiatrists are doing telehealth. And with telehealth, we just have to be licensed in your state, in whichever state that the patient is in. And it doesn't matter where you are, we can see you from anywhere. This is why I'm able to see people in 9 states. I'm actually adding 2 more, so I will be in 11 states soon. But we can see you from, you can stay at home. You don't have to get childcare, wherever you're comfortable at. You don't have to worry about driving anywhere or parking or anything. It's very convenient. And perinatal psychiatrists, what we do is a big part of what we do is we're able to do a one-time consultation, do a complete evaluation, and then we produce a complete write-up of your history and the recommendations for how to proceed with managing your treatment. And you can take that recommendation, that write-up, and give it to your psychiatrist or your OB. Take it to whichever doctor you're comfortable with, and they can use that as a guideline for managing your care. So I know it's difficult for people to access perinatal psychiatrists, but and unfortunately most of us don't take insurance, which is unfortunate, but that's just the way it is. But if consider it an investment into your health and the health of your pregnancy and your family. Get that one-time consultation, and then you don't have to continue to see us. You can take it back to whoever you're treating psychiatrist with, taking insurance and whatnot, but at least then they have that written recommendation that they can base their treatment off of for the rest of the period that you're struggling with this.
I think that's a definite, a wonderful, wonderful suggestion. I think a definite silver lining in the pandemic is certainly the access to care, access to specialists, specifically for us for perinatal mental health. And since you can see patients in 9 states, it certainly could be. It's an excellent investment that every perinatal family could consider. Mm-hmm. What else was I going to say? I can't remember. I'm so glad you were able to join with us today and talk about treatment options and resources, anything and everything to do with perinatal mental health. Certainly, if anyone has any questions, drop them in the comments and I can get them over to Dr. Cheng, and I'm sure she'd be glad to answer them for us. But we're so glad you're here, and I appreciate your knowledge and expertise in this area. I know what I was going to say. It was bringing up that not all psychiatrists are trained in perinatal mental health, because they are not. It's a very subspecialty, very important one that I honestly wish more psychiatrists and nurse practitioners and doctors would take advantage of that specialty and get trained. So another plug for Postpartum Support International. Yes. If you'd like to get trained, head over to postpartum.net to the professional section and look at some of those trainings. And so, yeah.
It is a very knowledge-heavy subspecialty, and unfortunately, it's so new actually compared to a lot of the other psychiatric subspecialties. We don't have an official fellowship recognition yet, so we don't have official subspecialty recognition within our board certifying body. So, like addictions, they have their own certification. Child adolescent, that's one of the oldest ones. They're officially recognized. Consult liaison, a bunch of those. But we are a growing group. There are unofficial fellowships that are sprouting up throughout the country. And once we hit critical mass of those fellowships, we would be able to legally apply for our certification board for official certification. So, the perinatal psychiatrists out there, we're kind of basically self-claiming that title because there is no official certification. But like I said, we're a very passionate group. We spend a lot of time and effort self-educating, and we talk to each other a lot. Mass General Hospital, their perinatal psychiatry program, they actually hold virtual grand rounds every single week. It is open to the public, so theoretically, if a patient really wanted to join, they could, but you probably wouldn't understand much. We're very technical there, but we talk to each other on a very regular basis. There's actually a couple of professional organizations for just perinatal psychiatrists, and that's why we know, we're a pretty small group. We know each other very well. We share a lot of information and resources, just so we can keep each other educated and up to date. Some of us are involved in research, so we do try our best to stay up to date on everything and get collaborative support for the cases that we do. So if you do find a perinatal psychiatrist, they've got a lot of other backing behind them as far as knowledge base. So we are a good resource for people who need it, and so please don't hesitate in reaching out to us. My own practice, I am in 9 states, so I'm in Alaska, Arizona, California, Florida, Illinois, Michigan, New Mexico, Ohio, and Texas. And I'm in the process of licensing for Minnesota and Missouri. And really, you just need to find one who is licensed in your state and get access to them. So I highly recommend using us as a resource.
Awesome. And that's great that y'all have a collaborative community together. How can you not in this space? I'm not sure, but
COVID helped with that quite a bit, I have to say.
Yeah. And I've heard those grand rounds are excellent. Birdie mentions it in the training all the time, how great they are. And I'm thinking maybe I should go myself and see what it's all about. So I will have to do that sometime.
All right. Well, thank you so much for having me. Thank you, everybody. You have a wonderful rest of the afternoon.
Awesome. Thank you so much. Bye, everybody.
Bye-bye.